Hi, I'm Darlene with SeniorLivingGuide.com, and I am your host for this episode. We are going to talk a little bit about I Can't Do This Anymore, and thank you for joining us. If you enjoy our monthly Senior Focus podcast, we can be downloaded and followed most anywhere you enjoy your podcasts, such as Spotify, Google Podcasts, Apple Podcasts, and so much more. We thank SeniorLivingGuide.com, who provides their online users with a one-stop solution to help seniors and their caregivers find and connect with the best step in senior housing or home health, all in one easy-to-navigate website. It's super easy peasy. And as I mentioned, we're going to talk about I Can't Do This Anymore when it's time for assisted living and nursing home. And we are joined in the studio today with Dr. Pam Tronetti and Janet Rooks. Dr. Tronetti is an osteopathic physician who specializes in geriatrics. Janet Rooks is a social worker and a dementia care specialist. They work together at the Parrish Senior Consultation Center, where they focus on the care of patients with dementia. Dr. Tronetti is the Director of Aging Services at Parrish, and Janet Rooks coordinates Parrish Senior Solutions, which provides education, resources, and support for seniors and their caregivers.
Darlene, you got the name of the podcast wrong. It's not I Can't Do It Anymore. It's I Can't Do It Anymore, because that's what people are saying when they come to this decision.
Yeah, just total stress and burnout, right? Yeah, we're going to talk about the difficult decision to patient loved ones in an assisted living facility or a memory care unit, and they even call it a nursing home. We're going to talk about the emotional decision and the cost, which can be quite high, coverage, how to choose which one best suits you, how you can help, or who can help you really with this, and what is the process afterwards, because it can be complicated. It's not just super turnkey. All of these decisions are super important as well. So let's help people understand that this is a difficult decision, and it is made with love. I mean, I just want to definitely preface it that it is a decision that is made with love. It is very hard, but it really is what is best for your loved one. So what usually prompts this decision when you have folks coming in?
They're worn out. They're just totally beyond their capability of doing it anymore. They're exhausted. They come into in my particular situation, or our situation, they come to my office and they're crying. 40% they can't sleep. They need respite care. They're just worn totally out. 40% of caregivers die before the person they're caring for do.
Oh my goodness!
And it's just there's no warning signs. I mean, I have family members that come in and said, Mom was taking care of Dad. There was nothing we knew. And now we don't know what to do. And it's just, they need help.
Never underestimate stress and anxiety and what it can, the toll that it can take on the human body.
Absolutely not.
Yeah.
Yeah, it upsets us both when somebody will come in, they'll say, well, I'm not just going to dump my mom or dad in a home. Well, nobody does that. People work beyond their capabilities, but they reach a point where they can't do it. Right. And some of it is the physical needs. You have a 90-pound wife and a 290-pound husband. She can't lift him in and out of bed.
Yeah, that's not happening.
Yeah, it's not. She'll try, but you reach a point where we say, we don't want them bringing you in, feet first to the hospital. Right. You need help. Sometimes it's the behavior. People get sundowning, they get aggressive, they get physically too assertive, that it's just not safe. And other times it's not the person, it's that the house isn't safe. There's too many doors to get out. There might be a swimming pool in the back. Or we've got, especially the guys, will walk in a room and say, it's too hot in here. I better take the thermostat apart and see what's wrong. I'm going to check the hot water heater. And the next thing you know, they're taking things apart. Or the person is putting oven cleaner in their hair. They're using nail polish to rinse their mouth. I mean, there's just too many dangers in a house that are not going to be there in an assisted living.
Well, even having a kitchen that may not be 24/7 monitored clearly is a danger, in my opinion. I mean, I know that's something I always worried about, is leaving a stove on, even if you accidentally leave it on low because you don't all the way turn it off, or leaving a pan on a stove that is on, or leaving the oven on, preheating it, and then forget you were preheating it, or putting something in and just forgetting you. I mean, all these things are super simple to do, and incredibly dangerous.
Yeah. They'll take, the phone rings and they get distracted, and like you say, the oven's on.
Yeah, I mean, someone that's not suffering from any cognitive disorders at all can do that on a day, but then you compound that, and it's just really super simple to have. Yeah.
Or even if you unplug the stove, what if they put something metal in the microwave?
Right.
And our favorite, what if somebody calls and asks for their social security number? What if they order something over the phone? There's just all kinds of things at home that the person would be better off and safer.
Yeah, absolutely. So we're going to talk about best options for placements, because there is not a one size fits all. It's you have to really do a lot of research.
And there's things in between that Janet will help patients.
Oh, yeah. There's those, I call them the stopgap things.
Yeah.
There's paid caregivers. I hear people all the time says, well, I'll check and see. I'll put an ad in the church bulletin to see, or I'll stick something there and just see if somebody wants to come and live with us. No, be leery of that.
Yes.
Because if someone has their mail forwarded to your home and they're living there, they have a legal right to, that's their legal residence, and you have to have them evicted. So in the state of Florida, you have to have them evicted. So no, I only refer to agencies. So be leery of someone just moving in to take care of your loved one. There's paid caregivers. So also there's adult daycare. We are truly blessed with some fabulous adult daycares here in Brevard County. Google, talk to, folks in your neighborhood, in your community, to find out what's available there. That way your loved one can go to daycare, come home at night, you're fresh, you can take care of them, they can get a good night's sleep because they're worn out. And it also has been proven that it can keep the mentation going, slow down that dementia, and it helps a bit. Also, family and friends, reach out to them. They can take them to the store, they can run errands for you, but also, take them down to the lake, down to the river, on a picnic, anything like that. And then there's the informal caregivers. And I'm not talking about someone that's going to come into your home, but someone that may come into your home to give you a break for just a little bit. Your friend that says, can I come over? Do you need anything? Keep a running list of something, cleaners, something you need at the grocery store so that you can't get out to get. Family members that instead of buying a tie every Father's Day, something like that, have the family members purchase private duty care.
I think that's a great idea. And I know that aging in place is kind of what the industry term is, I guess. And it's a great solution as long as you're able to do it. And I definitely encourage it. I think people should have the ability to stay in their own homes and have that freedom as long as absolutely possible, because I think I've mentioned before, once you move from that, you don't get that back. You typically don't go into an assisted living or memory care and move back into your own home. So it's having that freedom of as long as you can absolutely maintain it. And there are so many good options. I know home health has a lot of different options that have so many different levels. You can get just if you need a couple breaks for companion care. I know that my mom utilized companion care multiple times. Then it was just to go to the store and just to run errands and different things like that she wasn't able to drive after several surgeries. And and they had the same caregiver. I mean, that was one of the things that we made sure that it was the same person that she enjoyed spending time with. So it wasn't different people coming and going, and she really enjoyed this one person. And so she looked forward to having her come like once a week or twice a week, however many times it was. And she would come and she would cook for her, and then they would just run errands. She went and bought cards and the dollars, whatever the case may be. She enjoyed spending that time with her. So it was really, she found it really absolutely enjoyable. So there are some really good options, and never underestimate family and friends. And I think it's important you mentioned, the church bulletin. I'm not sure that's, clearly a great idea, but, if you are attending church, talk to your friends at church, because I think that that's a great, option to talk to some of those folks and see if they have time on their hands to be able to help with some of those things, especially meals. I know that that's one thing. If your loved one can't always cook, that they can help provide meals maybe once a week or something.
Well, and also in some of the retirement communities, and I'm not talking about like the assisted living, but some in the older communities, retirement communities, they have individuals that do that as well.
Yeah.
But talk to other folks that may have used them. Just because someone says they can doesn't mean they can.
Right.
And that they might be good. But, get some references before you just open your home up to someone like that.
Yeah.
But it's all about safety. Make sure that person, that you're in your home, but you're safe in your home, or your loved one is safe in your home.
Yeah.
And that, alarms on the door, this sort of thing. We have seen, I've heard stories of, grandma getting out in the middle of the night, or mama getting out in the middle of the night, and the police bringing her home, 2 blocks down the street. And because it's all about safety. It is all about safety, and, it really is.
Yeah, absolutely. I 100% agree with that.
Yep. But once you've tried everything, you've worked beyond your capacity, sometimes the only safe option for you and your loved one is assisted living.
Absolutely. Yeah. So we want people to understand that folks who make that decision aren't abandoning them. They're actually doing, the next step in taking the best care of their loved one and finding a place that works best for their loved one's personality, and meeting their needs both emotionally and physically and health-wise. I mean, there's lots of communities and facilities that provide mental health, they pay physical health, they have all kinds of, they have, speech therapy, occupational therapy, if your loved one needs those things on a consistent basis. They have doctors that come to them, so they're not getting toted around and getting in cars and being driven around. And sometimes I know with cognitively impaired folks that, all of that going to doctor's office causes stress and anxiety. So you reduce that. So there's a lot of things that can come with making those decisions that are super positive. So it's always good to keep those things in mind.
Absolutely. And, caregivers who place their loved ones in, it's the hardest decision they'll ever make.
Yeah.
It really is. And, and it's gut-wrenching. It just tears you up.
It
and,
is.
And it's also heart-wrenching. You're making that decision, and it's like, oh, man, I don't want to do this. But it becomes a matter of I have to.
Yeah.
Yes.
We always say, how much can a caregiver take? Just a little bit more. I can do just a little bit more.
Yeah.
But, and it's like, but then you go back to being the wife or the husband or son or daughter that does those special things. I often say you go back to, bringing in the cookies or the chocolate or the hand lotion to rub, mom's arms or massage her feet or whatever, those special things. You're no longer the warden. You're no longer the
Yes.
person that's fighting every battle. You got to take a shower. You have to. You stink.
You have
And
to
this
take
guy-
your medicines
You
right
have to
now.
take your medicine, and I told you. Don't you remember? I told you. I told you. I told you. And all the things that you're thinking for 2 people.
Yeah.
And you're still the most important person in their life. You are the captain of the ship. You just now have a team.
And you become, in the facility they work in shifts. They work in 8-hour shifts. So the staff come in fresh.
Yeah.
And as a caregiver at home, you never are fresh. I mean, even when you're asleep and you wake up the next morning, you wake up going, "Oh my goodness, what's he going to do today?" You know, I hope he sleeps. I don't want to wake up. Oh no, he's asleep. I got to call the doctor. He's sleeping.
Yeah.
So, you know, it's so heart-wrenching and it's so sad. And then, but you know they're safe. And if something is wrong, you know who to talk to. You really do. And they have access to call the doctor and get straight through to the doctor if there happens to be something that the doctor needs to do.
And that's also one of the things with assisted living is you have more control. If you think you've got everything in place because you've hired 3 shifts worth of people at home, what happens when they call in sick?
Yeah.
And then you're the one going over there for an 8-hour night shift. Or the cost of paying someone to come to the house.
It's significant.
As opposed to the assisted living.
Yeah. No, the cost of home health is definitely going to be significantly more if you're going to utilize it on a consistent basis. So that is, you definitely have to do some comparisons on what cost is. And there is typically no coverage for that in any kind of insurance. It's out of pocket. Yeah.
And I want to define our terms because home health to us is ordering home health services that are covered like after hospitalization for a nurse, a physical therapist. We use the term private pay or private duty care because it's self-pay.
Yeah, or custodial care of a companion, and that is private paid. There are, and we'll talk about it a little bit here in a little bit, that, you know, long-term care insurance will cover it after you get to a certain degree. Right. And, you know, the VA will cover it too if you qualify. We'll get into that a little bit later too.
Right.
But we have to break down those misperceptions about I'm putting mom in the home. People have this vision of like a hospital room, like the old nursing homes that, okay, there's 2 metal beds with 2 metal dressers and there's a couple little things,
metal side tables and gray walls.
With the TV going too loud and a shared bathroom with 2 or 4 people using the bathroom.
Right.
Most of the assisted livings are either like I say, it's like being on a cruise ship. You have a room that has bedroom area, lovely big bathroom, kitchenette, sitting area, sometimes a sliding glass door going to an enclosed patio, and then you come out for meals, for entertainment, for recreation. Memory units are generally a big main room with like little rooms that are more just, bedroom sitting, not the kitchenette, and a bathroom, but all private bathrooms. Right. And then the main areas where all the folks can congregate. It's just kind of a safer, more secure environment, less things to distract.
Yeah. Most of them, absolutely. Most of the assisted livings are private rooms. You know, if they don't have the kitchenette and that type of thing, they are definitely private rooms with private bathrooms. Very, very few I have seen with shared. So you do get that. It's like your own little private apartment, studio apartment, if nothing else.
Exactly.
And you have the option typically of bringing your own furniture, or you can have it furnished. I mean, typically they give you the option, but I think it's always good to bring your own furniture, your own little taste of home. So you do have the option of either or. Some of them even have guest suites. Some of the communities offer that. If you have company that comes, they have like a little hotel off at the assisted living where they can come visit and stay. So that's even sometimes an option on some communities. So, I mean, some of them have a lot of really cool things. Some of them have pools. Some of them have shuffleboards. Some of them have beautiful walking trails. They have all kinds of different things that you may not expect that's on site to enjoy living within those communities. And even memory care facilities have that as well, which they're locked down, so they're very safe. So you're able to enjoy them or have accompaniment on those, but they're secure facilities on the memory care side.
You said something I want to comment on, and you said living, because the individual is living there, they're not existing. And that's just so cool, and it's because they are living there. They're not just put into a room with the door closed and the nurse coming in and giving them their medicine and bringing them their meals. It's their home. And they are living there, and they're thriving there. And they're safe there. And the families can come and visit. I mean, granted, we just went through a pandemic, and we're still kind of in a pandemic mode and all this stuff, but that's their home, and they're living there. And a lot of neat things happen there. And you know, and when someone comes to visit, they're visiting their home.
Yeah, absolutely.
And it becomes a community. And there are also the small home-based boarding homes, or what they sometimes call, or just assisted living, that is a home where there may be 3 or 4 people who are receiving their care there.
Yeah, absolutely. And that might be a best fit for your parent or your loved one. You have to kind of decide what suits you best. And there's several of those that I've seen that look very unique and cool, and there'll be 10 beds, 7 beds, 5 beds, and it is a very small community, and you can kind of check that out, and it is more homier, more of a homier environment, and they're not going to have the amenities per se that you would find in a different type of community. So some of the larger ones have a lot of amenities, restaurant style dining, this, that, and the other, and then there's mid-sized ones that may not have all of those amenities, but they may have some. So you kind of have to balance what you're looking for, what's a priority to you, and if you're still real super social, maybe a little bit of a larger one might be good, because you have more social activities, you have more folks to, if you're like me, I can talk to a wall. So if you are a chitty chatter and you're real social, you might want a community that has more folks to do things with, social outings, if there's a really heavy activity director that's posting different things that are going on, and you're like, oh, look at all these fun things that I can do. Those are happening in a lot of those. So it's all about balance and kind of figuring out what best suits you. But the majority of these communities all have emergency call systems, emergency systems. If you need any kind of medical help, they have nurses on staff 24/7. Medication, someone that brings your medication, so you don't have to just think about having that off your to-do list every day, trying to remember what medications you should be taking and when you should be taking them, when someone brings them to you every single day in the correct dosages. I'm thinking that has to be super nice for someone that's had to worry about that or had to have a caregiver that's tried to make sure that you're getting the right amounts. So there's all these different types of things, and some allow pets. So if you have a pet, you can bring a pet, or they have pet therapy. So, you can look at all these different fun things and see, oh, I love it. And if you don't have a pet, but you want to be around people that do have pets, you can, there's going to be pets here. How fun is that? Or if you don't like pets, don't go to one that's got pets if you're not a big dog or cat person. So it really is. There's some things you always want to consider. And these are all just like the amenity side, but for sure.
Make sure that if in looking at the small home-based ones, that they're licensed. They're licensed by the state, and they're not just one of the small homes that they've decided they're going to take care of someone. If they've got a small number of individuals, they can do that without being licensed. So make sure they are licensed by the state.
Yes.
Because then there's someone overseeing their care, and they're meeting the standards of care.
The requirements.
Yes. And their website should have the license number on it. You can pull that license and go to the state and look it up, and you can find out all the information on that license per se.
Absolutely.
Yeah. So tell us about the cost. So Medicare, does Medicare pay for assisted living? We get this all the time.
No. And shall we all say it together? Yes.
No. Yes, that's correct.
No is a complete sentence.
Yes.
Yes, it is.
Yes, it is.
It's also a sad word.
Yes.
But it's the most common question I get asked. Is my Medicare going to cover this? Will Medicare cover it? No, it won't.
Right.
Most assisted living facilities is out of pocket. Long-term care insurance will pay for it. Some of them will. And there's also the VA aid and attendance. Now, if you are a veteran or a spouse of a veteran and they served during an active war, now it doesn't mean that you went over there and you fought. It just means that you served during an active war. 2 or 3 days. Now you can go on VA-aidandattendant.gov. Now make sure it's .gov and not one of those .anything else is on there, but make sure it's .gov.
The official site.
Absolutely. And there's a lot of really good information on there. You have to apply in your county of residence. So, and it takes a while to get everything processed, but it's well worth it if you're eligible. In Brevard County, we have a couple of gentlemen down at the county seat that will help with the application. On the if you Google the VA, there's a lot of things that'll pop up there, and they'll apply for you. Be leery of that. Stay away from them because they get part of the money. But it's out there. Look online and see if you're eligible.
Yeah, and we're talking $1,800 to $2,000 at the time of this podcast taping. That is nothing to sneeze at.
And that's a minimum. So, it really is.
And that's care at home or care and assisted living.
Private duty care at home through a licensed agency or assisted living.
Yeah, I applied for my dad. He ended up passing away before he ever got any of it. But the application itself was a lot of information. So be prepared to go back in the time machine to get some of that information. But, when our experience with the VA taking his application in Brevard was an amazing experience. They were super helpful, and they started getting everything through. But as I mentioned, it didn't matter at the end. But he would have been eligible for I would say 60 or 70% of the cost of his monthly assisted living rent.
What I had one of my caregivers do is she was applying for both her parents. Excuse me. She took a 3-ring notebook and she divided it up so every question was in the binder behind a tab. She got everything done, hand carried it down there and turned it in. She got them approved in 3 months.
Oh, wow.
So it can be done.
Yeah.
You have to be just very methodical and very precise. Don't just half do it because they're going to send it back to you, but it can be done. You just have to do it like you're applying, like you're doing your taxes.
Yeah, it's official.
It's very official,
Yes.
and you have to do it without cutting any corners.
The most important thing is having that military document, which I had. My dad
DD 214.
My dad kept everything. Thank God. He was a little bit of a, as far as documents, he kept everything. So he actually did have that.
But it's also online.
Oh, see, I didn't even know that.
Yes.
Okay.
So you don't have to go digging through the attic.
That is very good to know because I really did think, what if he doesn't have this? I'm going to have to apply to Washington, D.C. and wait forever for them to pull. I did not know that. That's awesome. Good to know.
But the next thing they ask is what about medical assistance? Because now Medicare is federal government. Medicaid, medical assistance, is through the state.
Yes.
And a lot of people who are in nursing homes are there under medical assistance because they had no other way to pay for that long-term care in a nursing home. You can get medical assistance sometimes. It doesn't cover everything, single assisted living. There's just specific assisted livings who will accept medical assistance. And what we usually see are people who got very bad advice about, Janet, I loved your sell your house for $1 to your son, and
please don't ever do that. A house has to be sold at market value. You can't sell it to your child for $1, and because there is a look back. Most of the time, it's 3 to 5. I've heard it up to 7 years, but the facilities are the facility does not want your home. They do not want any of that. The state does not want your home. They just want to prove that you qualify for them to write the check for your care.
Right.
So you have to prove that you qualify for this. I've heard people say, well, Daddy might need this, so I'm going to start moving money. Mm-hmm. No, don't start moving money, because they being the people that's Medicaid, the Department of Elder Affairs, is going to look back, say, okay, I want these bank statements. Well, if they get one bank statement for July and there was money in the bank, and then they got it for August and there wasn't any there, they're going to ask, well, where'd it go?
And that's kind of what I would say would be fraudulent.
Well, they're just not going to say, well,
I don't know.
Yeah, it's and so it's.
Yeah.
There's some things that you can do, and it's okay, and that's, prepay a burial, but it has to be in an irrevocable trust. And so there's certain things, but be careful. You can't shelter money. You can't move it around. You just can't do it.
Mm-hmm.
I would say probably consult with an attorney.
You do
consult with an attorney. I don't know this stuff. I know some things that you can't do.
Okay.
But I'm not an attorney.
It is, and also, when you talk to the attorney, say, now, if you have it in your mind that you want the Taj Mahal of assisted livings, will medical assistance pay for that one? We certainly have some wonderful assisted livings where maybe the paint's peeling a little bit, but the patients get great care. They're loved. They're a great community.
So set your expectations on the amenities. Yes. I agree with that from my experience.
Well, and look at how the staff are interacting with the patients, the residents. It's not about the pictures on the wall. It's not about the ruffled curtains. It's not about everything like that. It's about how the patients are being cared for. Do the staff, are they interacting with the patients? Do they seem happy? You can look online and see how. We were talking before we got started on this about the field trips and about some of that kind of stuff.
Right.
Is it all canned or is it real?
Right.
You can tell.
Yes.
And it's, get word of mouth. Sometimes the bad reviews are from staff members that were terminated for reason for cause. I don't know. I wasn't there, none of my business. But, talk to people. Talk to people that have been there before. And, sometimes your gut's going to answer your question. Use your eyes, ears, and nose when you walk in there.
Yeah. I definitely use your nose. I think, how an entire community smells is very key. How it looks is key. Is it clean? Is it, spick and span? And also talking to the residents. If someone is taking you on a tour, do not feel like you're being rude if you stop and start talking to a resident. How do you like it here? Do you enjoy the food? What have you guys done lately? And just see what kind of engagement that you get. And if they give you a good review, if they say, I hate it here, that's a red flag. Now, clearly some residents are just going to be grumpy. I mean, that's just the reality of it. So you might want to talk to a couple. But if you see family that's there visiting, stop and talk to family. Do you like this for your mom or dad that are here? Have you guys had a good experience? Get a review while you're there. It's not rude. I mean, whoever's taking you on the tour has to expect that you're going to want some of that feedback. So let's take a quick break, and then we're going to come back and we're going to talk about how to decide which senior or assisted living. All righty.
At Parrish Healthcare, we believe every life is poetry in motion, motivated by strength and determination. As your bone, muscle, and joint healthcare partners, we believe in blending the art of healing with the science of medicine to keep your body in motion. We believe in healing patients, healing families, and healing communities. For a free orthopedic health assessment, visit parrishhealthcare.com/orthoaware. Parrish Healthcare, where the art of healing comes to life.
Hey, Mom, how's the retirement home search coming?
Oh, my gosh. I'm just so stressed out. I don't even know where to begin.
Well, why are you so stressed? What's the matter?
I don't know where to find anything. I just need everything in, one place and know what all the options are.
Does the idea of searching for senior housing seem overwhelming and you just aren't sure where to even begin? SeniorLivingGuide.com has great news for you. We offer a one-stop solution to take the stress out of your senior housing search. At SeniorLivingGuide.com, both our statewide Florida edition book and website are created to make your senior housing search very easy for you to navigate. We provide details on communities, including retirement, assisted living, skilled nursing, memory care, and home health, allowing you to decide which best fits your needs and then connecting you directly with those communities. Visit us online at SeniorLivingGuide.com and start your search today and start de-stressing.
At Parrish Healthcare, we believe in our community. We believe in keeping our community safe. We believe in the art of healing. We believe in healing patients, healing families, healing communities. We believe in the best and brightest working together for the common good. At Parrish Healthcare, our team focuses on you as an individual because every life is a work of art to us. Parrish Healthcare, where the art of healing comes to life. Visit parrishhealthcare.com/healthaware for a free health risk assessment.
All right, welcome back, ladies. We're going to talk a little bit about how to decide which assisted living. I know we've touched on a couple of highlights, but there's a lot more to deciding other than pools and different things like that on what's going to make an assisted living best bet.
Mm-hmm. Well, one of the things I tell people is geography.
Yes.
You could be wowed by this gorgeous assisted living that's 60 miles away. Mm-hmm. And you say to yourself, oh, I'm going to visit every day. You're not. Mm-hmm. It's better to have someplace nearby where maybe the place is painted yellow with daisies instead of mauve and tan and whatever's the color of the year. But the people are nice. They're joking and talking with the patients. They know everybody's name. Mm-hmm. They say, Mary, you look lovely today, and that blue brings out your eyes. When you hear stuff like that, you say, this is a warm, loving place, and it's near my house, so I can be part of the team.
Mm-hmm. So I chose my father's assisted living based on those two criteria, and it was actually a Medicaid. But it was literally less than 5 minutes from my house, and I wanted to make sure I could go see him every day. I was so because it was like we talked about in the beginning. It was heart-wrenching for me to put him in an assisted living, but it had to be done. I knew it had to be done, and it was just heart-wrenching for me. But I wanted to make sure that I could go get him, take him to lunch, bring him to my house, go see him every day, and it wasn't something that was going to be a trek for me. Because where I live, I'm not close. I'm literally to the next grocery store is like 20 minutes away. And for me to go to the grocery store, it's just 20 minutes is a trek. So coming from Orlando where everything was like super close. So when I found this, I was like, okay, this is not the most amazing. It's not the most beautiful. It was older. It's an older community. I think it was built in the 50s, honestly. It needs some updating.
Hey, so were we.
Yeah. But the staff was amazing. It was small, so it was, I think, 50 beds, so it wasn't a big community. But I connected with them, and I could tell they connected with the residents. They knew all their names. And it was just, I felt like, and it was like being at home instead of being in a home. I don't know if that makes any sense. So that's why I decided to do that. Cause I could have put him somewhere else that was not, cause we weren't utilizing Medicaid. We were going to be paying cash like everyone else anyway, and found something different that maybe I would have some days gone, oh man, it's like 20, 30 minutes. I don't have time today, where every day I had time. So that really, you are absolutely correct. And it was the best choice.
But something just came to my mind. Your dad was older. Okay.
He was like 71, 72.
Okay.
Yeah.
So an older place was okay with him. He didn't need everything just being, he was comfortable there. Yeah. He was comfortable there. So sometimes what I have seen is people go in with their eyes. Not the eyes of the person that's going in there.
Right.
So they don't. They may be uncomfortable with all the fancy new, up-to-date things because they're out of their comfort level.
Right. And because he was in cognitive decline, it's not like he was going to be doing field trips or wine nights or any of these other things. He loved the fact they had music. They had people coming in playing on the piano. I saw they would update their Facebook consistently. which was lovely for me because I would be able to kind of see what was going on. And I remember, I'll never forget it, him dancing while they're playing someone on the piano playing, and he's just dancing and having himself a good time. And I remember going, I'm clearly working. I'm not there. I can see it. And I'm thinking, he is having a great time. It's not fancy. Someone's just playing the piano and he's just dancing along. He's having a good time. That just warmed my heart. It's just a memory for me.
And, you know, you have to meet people where they are. And sometimes families will say, oh my gosh, they're doing kiddie games. They're, you know, hitting a balloon back and forth. That was enjoyable for the patients. The patients say, I played volleyball. I painted a picture.
I bowled.
Yeah.
I bowled with
a beach ball and some plastic pins.
Yeah.
It's okay.
Yeah. They're having a good time, and that's all that really counts.
Yeah.
And now if you're like me, though, you like checklists. There is the Assisted Living Federation of America, ALFA, Alpha, and they have a website, they have brochures that you can go through and find these checklists to ask, what about my pet? Like generally you have to be able to take care of your pet.
Yes.
So they don't want if somebody comes in and the pet's going to be going on the floor. That's not going to fly.
That would be bad.
You know, is there a nurse or a nurse practitioner or a doctor who's going to come? My little pet peeve, what are the cell phone rules for the staff? Oh yeah, you don't think about those things.
No, that's a good one.
Everybody has a cell phone in their pocket. If you walk in and 3 of the staff members are sitting there texting, watching things on their phones, no.
That's a good one. I like that one. And we also have, and I know I mentioned this, our website, SeniorLivingGuide.com. We are basically a one-stop shop. You can go online and check out, put in your area that you're looking for specifically, and communities, home health care.
Across the United States?
Across the United States.
Oh, wow. Comes
up, and then you click on that particular community, and like a little landing page, a little mini website comes up with amenities, the pays that are accepted at that community, video if they have it, a lot of pictures, links to their social and their website. And then you can save it if it's something that you're interested in, but maybe you don't want to look at different ones. So you can save it in a little folder, or you can contact them, all kinds of different things. So there are different areas that you can utilize to do some research online or utilize this checklist brochure prior to going in, so you can kind of narrow down your search for what fits your needs.
And you have to be realistic. Like I've had folks say, well, all they got was a sandwich and soup for dinner. Right, because the main meal in an assisted living is usually lunch.
This is true.
And actually most of our patients with dementia don't want much of a dinner, a supper.
Yeah. And soup and sandwich for dinner is a full meal for them. They don't want a big meal.
And that actually is probably not a bad idea for everybody.
No, it's not.
Yeah, probably not. But
I eat a bowl of cereal a lot of times for dinner.
And, you know, what are your parents' needs? Because, yes, there is an extra fee if your loved one needs help bathing, if they need help getting dressed, if they take their own medicines versus getting medicines through the pharmacy and the staff. So you have to add that up. Maybe one seems more expensive than the other, but guess what? The other one that's cheaper is going to nickel and dime you. So, you know, you got to be very realistic, be Mr. Spock.
Yeah, and then go back to, okay, if they were home and you were paying for private duty care to come in, weigh what it would be 24-hour care at home versus 24-hour care in a facility, to where that you can just go back to being the daughter, the wife, the husband, and everything like that. So, you know, weigh your odds and the care that's there.
Yeah, you can go and have a lunch date versus, you know,
wishing you had a lunch date.
Yeah, yeah. So there are different levels and costs for all of these different communities. Some of them can run, you know, $1,500 to $2,000. Some I've seen some communities, not to freak anyone else out, but $15,000 to $20,000 a month. I mean, it can run quite high. So always be prepared for some sticker shock, but know that there are communities out there that are just as lovely that are affordable. I think that's good news.
Well, it's like the cruise ship. You can have the regular room, or the person has the suite. You're still getting the same meals, the same entertainment, the same people taking care of you.
Right.
So yeah, there's nice people available at all these places.
Yeah. Right. And you can add on certain things. So if you don't need the bathing, then you may pay less than someone that does need additional services. So.
Yep.
So how do you get them there? Because while you realize maybe that it's time and some folks may be ready to go. Some folks may realize that they need to move into assisted living.
Janet and I are ready now.
They're ready to make that
3
move.
meals a day and entertainment. We're up for
Somebody
it.
doing my laundry, cleaning the bathroom.
And most of them do their laundry, and housekeeping is included. I'm just throwing that in there.
This is true.
In fact, I think all of those options. How do you get them to want to leave their home?
Oh, it's so easy,
It's the
Darlene.
want.
You just say, Mom, Dad, I think you need to be in assisted living. And they go, sure, okay.
Yeah.
She's delusional.
Yes. This I think is going to be the key.
It is.
And it's
It is
actually
the key.
required, correct? In order to I don't want to say enlist or enroll in an assisted living. You have to.
You can't place someone against their will.
Exactly.
So yes, and maybe. I'll go maybe.
Okay.
It all depends.
Right. You sometimes it's up to us. We take it on ourselves
creative.
as medical professionals that we say, I'm sorry, but because of your medical needs, right now, we need to have you in assisted living where we can then get physical therapy and occupational therapy and see if we can get you stronger. So sometimes it's presented as a temporary thing, because sometimes it is. Other times it's, you know what, you've fallen twice, you've broken your hip, home isn't safe, we need you to be here for your safety, for your family. So sometimes the patient comes and visits and they see that, oh wow, there's some ladies I used to be in my neighborhood, they're here, and they're a little bit more accepting.
And sometimes it's a step down from when they were home doing fine, they had a medical event, they were in the hospital, then they went to rehab in either a rehab hospital or a rehab unit of a skilled nursing facility.
Right.
And this is a step down that they may or may not go back home. But it's a step down, like Dr. Pam was saying, to get the rehab additional therapies and stuff, and they may or may not be going back home. But it's all in the approach, but we do not place anyone there against their will or help the family place them there against their will.
Right.
It's all in the presenting it.
You just show the medical need. So when they take that to the assisted living, that medical need is presented.
Yeah.
But sometimes it's, Dad, Mom needs a medical procedure. Mom has, God forbid, cancer, a heart attack. She needs to be in the hospital a while, and we need you to stay here. And we'll be there every day, and we'll visit you. And it's the family spokesperson that kind of greases the wheels.
Right.
To say, this is what needs to happen. And, there is a transition. And some people are fine with it, and then they sundown a little bit and they just get a little antsy. Like, why am I here? Where's my wife? And that's when sometimes we need a little anxiety medicine. Sometimes it's the staff that just needs to redirect. Sometimes they need to get on the phone and hear, oh, I was worried about you. Oh, no, I'm okay, but I'll be there tomorrow to see you. Okay.
And in those cases, how the apartment or their apartment set up before they move in.
Yes.
So we have everything set up so they have some familiarity before they ever go in. And and I've been over there when they've moved in. It's like, oh, I've got a picture like that at home. I have, and it's like their comfort. And so they're not walking into, like going into a hotel and everything is new. So they feel okay eventually. But it's all about their safety, and the family, the role of the family is so very important in getting that. The staff are phenomenal in that reassurance and that comfort, and it's amazing to see the other residents just nurturing the newbies coming in, because they do. Oh, you can come sit with us. You know, or they'll motion you to come over. They're having a hard time, but I'll ask them to sit with us, or we're going to play bingo later. I'll ask her to come and play bingo with me. And it's just amazing how the other or like you said, they'll notice somebody they know, and before long, they don't even, you know, I'm waiting for my daughter to come visit.
Yeah, no, I agree. And, you know, getting back to a little bit about what you talked about as far as the transitioning from the house to the assisted living, that's one thing we did with my dad. We took him out. He did not see the chaos. So he didn't see us taking the things out of his house.
Absolutely.
I was afraid he would freak out, and he probably would have. Taking it out of his house, and then we set up his assisted living. We put the pictures on the wall. We organized everything. We put all his clothes in the drawer. So he was at a girlfriend of mine's house, and I picked him up from her house and drove him directly to the assisted living, so he never saw his house dismantled. So that, I think, was hoping, and I'm still hoping, that was the right decision, because I just wanted him to walk into familiarity, everything put away, there's no chaos. I was trying to delete as much chaos out of his life, but I do think that was important for us to do, so that he didn't have the crazy. So.
And we'll tell people, if you know it's coming, pick a place or pick 2 places, fill out the applications, have them ready, know what you need to do when there's a crisis. Because many's the time we've got a phone call, mom was taking care of dad, mom's in the hospital, dad's home alone, now what do we do?
Oh, yeah.
And I can't take him to my house.
That's right. So now you have to go look and choose and make a decision. I'd rather have your name on the list and get a call every month saying we have a room, and you say, well, no thanks, not yet. And then they call again next month. And then when you need it, it's, well, my name's been on the list for a year.
That is a really good idea, because I don't think people do that, because they're in a place, they're good, they're fine, they're trucking along, but they haven't planned for that. So to go and make a decision on what they would like in case of an emergency, so they don't have to do that in a scramble. To find which community or facility works best for them.
And I've also made that recommendation with the private duty agencies, that I'll tell family members to do the same thing with the private duty agencies. Interview them, have a standing contract, so that if, heaven forbid, something happens to mom or dad, the primary caregiver, and they end up in the hospital. This is if family members living out of state, and you know you're going to have to come. They can't go to the hospital, and you know the hospital's not going to be there to take care of your loved one while we wait for you to get here. But that private duty agency can. And you're not going to be able to interview them over the phone and do that. I mean, it can be done, but it's a time frame. If you've got something already in place, it's a phone call. You know, hey, I need you to come over and be there until I can get there. So, I mean, we do everything we can. To have that already in place. So we've thought about it.
That both of those things are not something I have ever thought about or have ever talked to any, you know, clients or you know, anyone about, because it just never occurred to me. But that is fabulous information, and to pre-plan for both of those things, it's such a great idea. I love it.
We're the what if people.
The what if.
We really are.
Expect the unexpected.
That's why we're here.
Now, when your dad first moved, did they tell you couldn't come visit for 2 weeks?
No.
Okay, because that's kind of standard in a lot of places.
Is it?
As the person that the assisted living becomes their new normal.
I'm not sure I would have done that so well.
Really?
No.
We found over the years that it seems to be
really
easier.
Sometimes just let them get settled into a routine, you know, just to kind of get in the groove, if you will.
that would have been harder, maybe harder on me than it would have been on him. But no, they didn't say that. And I have not heard that.
Okay.
But that would be that would definitely be a question you want to ask.
Yeah.
Yeah, for sure.
Yeah.
So, well, I think that if we have any closing thoughts, ladies, that we want to add.
Just that you still are the captain of the ship. Mm-hmm. You're the one monitoring their care. And I have a couple of go-to points. First, nobody prescribes anything that you don't know about. Mm-hmm. You must be kept in charge. And once a month you say, I want to see the medication administration record, the MAR, to see what was given. Because
100%.
Absolutely.
Yes.
Because I've taken over care of people that the kids are like, what do you mean they're on this, that, and the other thing? Nobody said a word to us, and we're the POAs. Okay, what are their other medical needs? Like, do they need to go to the dentist? Do they need to go to the eye doctor? Just because somebody's coming in to see them, they're not getting their eyes checked.
Right.
My best recommendation, look at their feet. Take their shoes and socks off. And if the nails are overgrown and the dead skin is hanging off the legs, they're not getting the care that you're paying for.
Yeah.
That is well noted. Mm-hmm. So it's really looking at the feet, taking the shoes and socks off, looking at the toes, looking at the skin, and that is a big key.
Yeah.
I never thought of that.
Yeah. And I have one statement that is, remember, at the end of the day, you're doing it for them, not to them.
Yeah, that is well noted.
Yeah.
Yeah, definitely well noted. All right. I think that that's fabulous, ladies. Thank you so much. This was another fabulous episode. Thank you so much.
Thank you.